Tennessee needs Medicaid expansion now!
For Medicaid expansion filters throughout the economy, from hospitals to doctors, healthcare workers, and it's essential that we stop losing $2.6 million a day in federal funding that we could be getting for Medicaid expansion in our state. The idea behind the Medicaid expansion, was paid for by cutting money that the federal government gives to states, that states then give to hospitals to help offset the cost of charitable or uncompensated care. Hospitals are seeing reductions in that money, but in Tennessee they're not seeing any increase in funding from Medicaid expansion. So our hospitals are hurting. Yeah. And some hospitals have already closed. Our own local hospital has cut its budget, as have other hospitals across Tennessee. And some hospitals have already started to cut staff. The CEO at Vanderbilt said that a third of their healthcare cuts have been attributable to the lack of Medicaid expansion in our state. And the healthcare sector was one job sector that was very reliable in terms of growth. Even during the big recession, healthcare jobs increased. But now in states that have not expanded Medicaid, we're starting to see cuts or stagnation in the healthcare employment industry. So we're losing jobs by not expanding Medicaid. As of today, we have lost $703 million because we have not expanded Medicaid. That's $700 million they could have paid for health care for people in need. 157 Tennesseans are expected to die if we don't expand Medicaid because they will not have access to health care. So this is a critical issue, and it affects everyone. If our hospitals, right now, the cuts in the federal funding for uncompensated care are in the millions. In the years ahead, that will be billions. And in the next 10 years, if we don't expand Medicaid in our state, our hospitals will lose $7.7 billion, with a B, dollars in funding. We have an experiment going on now where you can see real-world results because some states have not expanded Medicaid and some have. And the healthcare law and Medicaid expansion is working exactly how it was supposed to in the states that have expanded it. Their hospital revenues are up. They're seeing a dramatic decline, as high as 80% in some states, in uncompensated care. And these are all dollars and cents. But the real issue for many Tennesseans isn't whether it's good for the economy, whether a healthcare worker loses their job or not. It's whether or not they can get health care. Can I go to the doctor when I'm sick? Can I go to the hospital and not have to worry about losing my home? And those are the people that we want to have speak now so that we can hear from people who have fallen into that coverage gap. Right now we've got an unequal and different healthcare system depending on where you live in the country. In some states, everyone has access to health care, and in other states like ours, some people don't. So we want to hear from the people who have fallen into the gap now. And Barbara, the Drains were going to be here. You may have heard about Larry and Linda Drain, who have Mr. Drain has been writing letters to the governor every day because he and his wife have had to separate so that she can keep her TennCare for her chronic medical condition. So we want to keep families together, and we want to have people get the health care that they need. In case you don't know, the only people who can get Medicaid in this state currently have to meet income guidelines, but they also, which are quite low, but they also have to either be disabled, pregnant, or parents. So if you are just a working poor individual, there's no help for you out there. And we want to make sure that people get the help that they need. And if you're talking to people and they're saying, well, this doesn't affect me, it will affect everybody if our hospitals start closing. Because if a hospital closes, then the doctors who work at that hospital may decide they can make more money somewhere else. And if the doctors go, then you have to wait, you have to travel farther to get health care. And sometimes in an emergency situation, traveling farther can be the difference between surviving and not surviving. So this is a life and death issue. This is a quality of life issue. We have to get coverage for the people in Tennessee. And the federal government is willing to give us all the money for the next couple of years. And the 3 years that they paid for started on January 1st, 2014, and that clock is ticking. Every day we don't expand Medicaid, we lose $2.6 million. And that's money that could be helping people. So I will second what everybody else has said to if you haven't registered to vote, register, talk to candidates, ask how they feel about Medicaid expansion. We've got some candidates.
We should be able to afford health insurance, all of us, every one of us. And we're not out here asking for handouts. I'm working hard, and I just don't make enough to make ends meet. So thanks so much.
Or anything else, just because we have not expanded Medicaid in Tennessee. It's just a shame that we are denying health care, and we're really killing people because they don't have the money or don't have the insurance or anything to go to doctors or to hospitals. The second situation is a more personal one, is my stepdaughter, who had a terrible bladder condition and could not get Medicaid, tried to get insurance, certainly was turned down from all insurance because of her chronic bladder condition, and finally after years and years was able to get disability about a year and a half before she died of pancreatic cancer. So we certainly have a personal experience of where her medication was so expensive and she just had to do anything she could to get it. So we have people that are suffering and dying in the state of Tennessee, and we don't have a governor or we don't have legislators who have a backbone to care enough about the people. Thank you.
By 24, and it winds up being $2.6 million a day that the state of Tennessee is burning by not expanding Medicaid. Our local hospital is suffering from the fact that the federal government has closed down some programs because we went to the ACA, and we're not getting the expansion of Medicaid in Tennessee. Kentucky, by comparison, has expanded their Medicaid program, and they're doing quite well. They're used as an example of a state that works as far as the expansion of Medicaid and the ACA. It's by the governor, but we need to use this campaign to focus on expansion of TennCare so it will prod our legislators and the governor toward doing the right thing. Thank you.
Everybody covered, nobody not. Everybody covered, nobody not. Medicaid now. 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 Expand Medicaid now. Expand Medicaid now. Expand Medicaid. Everybody covered. Nobody not. Everybody covered. Nobody not. Everybody covered. Nobody not.
What do y'all want?
Expand Medicaid.
When do y'all want it?
Now.
What do y'all want?
Expand Medicaid.
When do y'all want it?
Now.
Yeah, I firmly believe that this is not a partisan issue. It's not a Republican issue. It's not a Democratic issue. It is, in my opinion, a moral issue. There's a moral imperative. It says that we should all help one another. And not expanding Medicaid is not only not helping, it is hurting people. And in many cases, people are losing their lives. This is not a partisan issue. It's not Republican, it's not Democrat. It's simply compassion. It's being human being.
I think most people don't realize that anyone who gets disability, finally gets disability, cannot get insurance with disability for 2 years. So anyone that gets disability at 64, they don't get it until they get Medicare at 66 possibly. This Medicaid expansion is the only thing they can use for those 2 years in between. And of course, if they get disability, it means they're not making very much money. They can't make over a certain amount each month. So this is the working poor who need the Medicaid expansion.
We believe that everyone in this country deserves affordable health care. And Tennesseans are citizens of this country and they deserve affordable health care, and there's a way of getting it. The federal government has said that they will pay to expand Medicaid, and we believe that that should be what's happening in Tennessee. Expansion of Medicaid to cover all people in Tennessee.
We want everybody covered and nobody not. We don't want anybody to be without insurance. They should have it for their own health.
Health care for all, that's what America needs. No one should be a citizen of the United States of America without some type of universal health care.